NASMHPD, the National Association of State Mental Health Program Directors. What that means is that we work with the leadership across the country in mental health in all the states and territories. Our goal is to improve mental health services, improve the quality, improve the quantity, so that everyone can get the service at the level that they need. I think one of the good things that's happening around the country is that the most suicide calls are answered in a timely, in a timely fashion. And that's in large part due to the National Suicide Prevention Lifeline and the work that they've done. What isn't working so well is the importance of having mobile crisis services, stabilization units, short-term residential. That's not standard across the country. So typically what you end up getting is a 911 response, similar to what you have with physical health care. Individuals in crisis, they don't know what to do, or they call their after-hour therapist, after-hour answering line for their therapist or someone in the mental health field, and they say call 911 or go to the nearest emergency room. As a result, we have an overutilization of the emergency room, and we have individuals that the response is such that they call 911, the police go out, and often in order to resolve the issue, the police will do an arrest and the individual will go to jail. As a result, with the current system, we have too many people going to a level of service they don't need or ending up in jail. I would refer to the national guidelines that were put out by SAMHSA in February. What SAMHSA put out is a really nice guidance, and we've been promoting that to all of our states. So that they can look at their crisis services and compare what they have to what's in the national guidelines. What's in the national guidelines includes crisis call line, mobile crisis, stabilization, short-term residential. In addition, what seems to work best is if you have a policy of accepting everyone and accepting them quickly. With the COVID-19, one of the things that's done is really put a lot of pressure in doing something other than arresting and taking people to jail. So that has really emphasized the importance of crisis programs that have where they do the triage in the community. What that means is that they basically will have people who walk in or who are dropped off by the police. They'll take over the case, and then if the individual needs a higher level service, they will connect them with that higher level service. Those programs that work very effectively with law enforcement, so they have a fast drop-off, are what's best. Arizona is used as a good example. Whether you're talking about the Tucson area or the Phoenix area, they've been in the leading, among the leading states to set up sequential intercept model, trying to intervene as soon as possible, and trying to be as friendly, consumer-friendly, police-friendly as possible. As a result, they've been very effective in working with the police. The more we can work with the police, decrease the involvement of the police, have it so it's much more consumer-friendly, giving the individual the service they need at the level that they need, rather than pushing up so the triage is done at the emergency room or a higher level. That's really the best model. And in Arizona and in Tucson, they're doing it. If we think of the individual who is dealing with a crisis, or the loved one that is trying to get help for their family member or friend, trying to make it as easy as possible to get the service. I think that's the main advantage, and making sure that the individual is getting the care at the level they need, so they don't have to go in the hospital. They're not going to jail. They're basically getting their service in the community at the level that they need it. It's important to point out that if somebody goes to the emergency room for a physical health care reason, about 15 to 18% of the time, those individuals get admitted. If someone goes to the emergency room for a mental health or substance use disorder issue, over 50% end up getting admitted. So what does that mean? We're overutilizing resources. It's more costly, as well as being unfair to the individual who's getting a service that they, at a level they don't need. So I would add that one of the big advantages, and I think it's important, especially during this time that we're looking at less revenue going to the state and localities, is that this example decreases the cost because you're treating people at the service level they need. You're not sending them to jail and incurring all those costs. You're not tying up police time and incurring those costs. You're not overusing the emergency room and inpatient and incurring those costs. So one of the big advantages of this type of an example of the national guidelines example is that it's very, very cost effective. Let me stop for a second and talk about the 988 system. 988 has recently been approved by the FCC as the 3-digit number to be used for crisis. It's currently being discussed in Congress, but we're expecting it will be passed by Congress. If that happens, then the 3-digit number will go into effect July 2022. So if we think of that as being our target, if we can get all the different leaders within states working together to magnify, to market that 988 number, to really think about it as more than just the number itself, but really to look at it as an opportunity to move from a 911 system, which is very effective for physical healthcare, to a 988 system, which could be equally efficient as 911, but have it equally efficient for the crisis system and for helping people with mental health issues, substance use disorder issues. So I look at the example of what we could do with 988 and all the leadership of the states working together. I think that would end up with a really good system so that in 5 years, we'd really be proud of a 988 crisis system of care based on the SAMHSA National Guidelines for Behavioral Health Crisis Care, and it would be standardized across the country.